Hello and welcome to another episode of Plastic Surgery Unfiltered, podcast at the intersection of healthcare, business, and the beauty industry. I'm your host, Dr. Armando Davila. I'm joined today by my guest is Katie Enos, one of my physician assistants. How are you today?
Good.
Good, excellent. Today, our topic is TikTok made me do it.
Love it.
You love it?
Yes.
All the things that TikTok makes us do. So Katie, the idea behind this podcast is I wanted to talk a little bit about where people are calling sort of preventative plastic surgery, or this is like very popular on TikTok, and especially with the kind of Gen Z, our Gen Z PA. So tell me a little bit about some of the trends you've seen or some of the things that you have kind of seen floating around in TikTok around plastic surgery.
Yeah. I think about even influencers today have become such a big thing in social media too. Mm-hmm. And they're becoming more candid about the things that they're doing, which then I think in turn makes Gen Zers, we'll call us, a little bit more interested in they're seeing those things from the influencers and then wanting to do those same things.
Okay.
And so things that I've seen like floating around are like, doing your own microneedling at home with, in topical peptides and things like that. They're buying Botox off of who knows where and trying to inject and do this baby Botox thing. People buying biostimulants and injecting them, which I think it's definitely scary to see. So
yeah, I mean, I'm on the surgical side, I've seen things like, I think one of the biggest things that have caught the media are like the buccal fat removal. Mm-hmm. One thing that has been very traditionally young plastic surgery exposure from a surgical perspective has been rhinoplasty, and that's been true for many years. But there's some changes that have kind of occurred to that region. Mm-hmm. But yeah, I guess some statistics to kind of like look into the into sort of the I don't want to call it a problem, but the current market space. Mm-hmm. Again, there's about 20 million minimally invasive cosmetic procedures performed in the U.S. So that's like one in almost every 10 people have a minimally invasive cosmetic procedure. So it's much more prevalent than we might think. And again, you have about 10 million of them are neuromodulator treatments. Mm-hmm. So again, that's 3 to 5% of the population is undergoing neuromodulator treatments. Mm-hmm. And the patient in their 20s are the fastest growing injectable demographic. And right now, if you survey them, there's about 50% of them say that social media is influencing their decision to undergo some of these procedures. So, why do you think, you mentioned that you see these kind of influencers participate, but what about it do you think in social media is kind of this, why does it drive it so well, I guess, or...
Yeah, I mean, like I said about the influencers kind of sharing I feel like before, like years ago, most people didn't want to share kind of what they've had done per se, like no one wanted to say like, oh, I had a rhinoplasty, or, oh, I get filler, I get Botox. And now it's kind of this like, I'm going to get my Botox today, let me take you along type of thing. And then people become more interested in it. And, younger people, Gen Z people are like, oh, maybe it would be preventative for me and I can get like ahead of things. My favorite influencer is doing it, I should do it too. Okay. I also think that even things like filters and things like that, those used to be big, also have played like a role in doing some of these procedures.
Yeah, I mean, I think that I think that one of the things that has driven desire for treatments is, I think, a little bit of the filter concept, mm-hmm. right? I'm a photographer, and I've always known about, we don't understand that what's called the focal distance, or the focal distance of a camera determines the distortion that the lens produces. And in particular, we have these wide angle style lenses in our cameras. Even the default camera is still a wide angle lens. And so if you everyone who's ever stuck the camera very close to their face sees that their nose looks bigger compared to their eyes. And, there's all these proportion things that start to feed into how it looks. And so you take this picture, you take a selfie, your nose is huge, and then you apply a filter to make it look smaller, making you start to think that like there's something wrong with the size of your nose when the nose may be just fine in size, but it creates this kind of illusion because you only ever see yourself through the reflection of your phone or your mirror. And I think that the second part of this is, right, the algorithms that influence the filters themselves are in and of itself like a sort of AI homogenization, right? It's like it's making everyone look exactly the same, right? And so it's not like the filter customizes the appearance based off of like your particular features, which is something like the software that we use. Like when we do 3D imaging, like our software does do that, right? But the thing you're getting on TikTok kind of doesn't. And so I do think that there's this sort of illusion that is driving people to want to look very uniform and lose kind of some of the qualities that makes them unique, I'm sure you've heard about upper lid blepharoplasty and the Gen Z. Why do you think, like, that's a kind of curious one. I still don't understand why that's being driven.
Yeah, I mean, I think back to them seeing other people on Instagram and things like filters where they're constantly looking at themselves and they're, looking at their picture like, well, if my eye was just like lifted a little bit, or I see this little loose skin when I'm driving and I look in the mirror, and things like filters and influencers showing their journeys of getting an upper blepharoplasty have really made an impact on the younger generation in that instance.
But is it like objectively, do you think that there's a problem with it? Is it bad to be caring for your skin? Is it bad to be doing some of these things?
No, I think that there's definitely a range of, doing things is what we would call like prejuvenation. Okay. And starting that, starting like the Gen Z would be sort of in that prejuvenation where they should be starting. And I think that there's a range of where you could go a little bit too far with things like people doing it themselves. But I think there are people too that actually may have problems and could benefit from an upper blepharoplasty. Again, we are all different. And there's all things, those are the things that make us unique.
Yeah.
So,
I mean, I think to talk about like upper blepharoplasty before we move on, I want to address skincare first, but, one of the things that we struggle with is, like I want to take a particular example that's not a blepharoplasty, which is, I think it was Kylie Jenner, or one of the Jenners, with the like the 450 or something, half under the muscle.
Oh, the implant.
The implant thing. And so there was, this sort of semi-viral post of her talking about her breast augmentation and how the breast augmentation was accomplished. And I've had a few patients ask about that, right? Yeah. And, the half under the muscle is not technically true. It's the way we explain it to patients, what we're doing, but it's not a procedure that is like the surgery isn't actually half under the muscle. It can be in specific circumstances, but it's a very nuanced kind of thing. So like one of the things I think about in blepharoplasty is sometimes there's a functional upper blepharoplasty. Like it's not about just excess skin that happens with age. You may have a distorted epicanthal fold. You might have an incorrect levator insertion. One of the things that is very common in like Korea, for example, is making like a Caucasian style eyelid. So a lot of young girls in their teens and 20s get upper eyelid surgery, not to remove any excess skin. It's really just to create a tarsal fold and to make the eye look more like a westernized, right? Or more, westernized. And so, there's different reasons why a blepharoplasty might make sense, but in the TikTok sphere, it just becomes all just like upper bleph, and people are like, I have extra skin, and it's like, well, that may not be the reason you need it, right? Let me start with skincare real quick. Like, what do you think? I think that skincare is a great thing that people are getting into. Like, what do you think are some things that people should be doing in their like 20s for like skincare?
Yeah, I mean, like I have started on that journey as well.
Okay.
And so I think that skincare is definitely super important in, again, like that prejuvenation phase, and getting yourself started on like vitamin C's and sunscreen and things like that to help your skin. You know, like obviously this like glass skin thing has been super popular.
Okay.
But I think that especially on TikTok, like Carly said it best, she called it the DIY era, and people kind of doing things too much or excessively to create that effect, and it actually can be harmful.
Yeah, I mean the way you generate a glass skin effect is generally through like decently extreme microexfoliation. So like again, to get a little bit technical for people on the podcast, right? You have a couple layers of the high part of your skin. You have the epidermis, which is actually split into 7 different layers. And then you have the dermis, which is the layer underneath that kind of gives the skin its elasticity and its bounce, right? There are procedures that we do in this setting, in the medical office setting, particularly when guided by a physician, that get you down all the way through the 7 layers of the epidermis down to the dermis. Once you get down to that level, you can develop scarring, problems with pigmentation, really permanent issues that are really difficult to fix. And so those are definitely things that you only want to do under the supervision of generally a physician. Okay. Even though, and I do see in a lot of med spa environments that non-MDs are performing treatments that really pierce through down to the dermis. Those can be problems. Those are where I see a lot of botched problems, right? And then they don't know how to like
correct
solve
them.
the problems. Anything above there, you can still hurt things in the epidermis, but less likely to cause like a permanent effect. It's usually short term. Like, but I do think that what can happen is as you kind of peel off parts of those 7 layers down to the dermis, that's when people at home could like do it through serial treatment, right? How does like, what are exfoliants that you see and what do you use right now for exfoliation?
Exfoliation, I use like a scrub once.
Physical exfoliation?
Yeah, once a week.
Okay.
I really don't do it more than that. And then I use retinol, which,
as your secondary exfoliant.
Exactly.
Okay.
Yeah.
Tell everyone what retinol does.
Yeah, so retinol like increases cell turnover essentially, but incorporating it into your like routine can be difficult. And some people it's hard. You know, you're sometimes have like purging and your skin can become really dry, and that sort of thing. And so I think some people are a little hesitant to start using it.
Yeah. I mean, retinol is hard, right? Like what retinol does and what purging means is, again, you have these layers, these like, on the upper layers of your epidermis, there are these like there's this cap. This is the flaky skin that kind of forms, and you're usually exfoliating when you do like physical exfoliation. Retinols, what they do is stimulate like production of that epidermis from the dermal level, and then your body starts to kick off the highest ones on their own. So it's not a technical exfoliant, but it does sort of cause that process to occur. And over time, you get less and less of that kind of permanent cap, and the skin looks like more refreshed because your body's constantly turning it over.
Yep.
But then it can create that redness and that irritation, especially if you're combining it with then aggressive exfoliation. You know, I do think that, you know, people will see a lot of like hydroxy acids, like alpha hydroxy acids or other hydroxy acids. Like, I think those are good chemical exfoliants. Again, coming up with a good exfoliation plan is I think a little bit DIY.
Yes.
Like, you know, you may be given a product and the combination of exfoliants that product has may work for you, it may not work for you. And that's, I think, one of the like most difficult steps to nail for a particular individual, because too much exfoliation becomes very obvious, right? It's like red, it's irritated. Too little and it feels like nothing's happening.
It's hard to find that balance for sure.
That's one of the biggest like products.
Yeah.
Okay, what about other layers that Gen Z, what is other we have the retinoids, we have the exfoliation. What about hydration? What about our moisturizer? What do you use, and what do you think about that layer?
Yeah, I mean, I struggle with moisturizer myself because I feel like I have combination skin. And so like sometimes it's really dry and I like use a really heavy moisturizer and then I break out. And then my skin, so it goes back and forth. So I use B5.
Okay, you like the B5 gel?
Yes. It tends to work for me. That's probably not the best thing to use, but yeah.
Well, like, why do we have to moisturize, I guess?
Yeah, I mean, adding hydration in the skin, I think I also use HA intensifier too, which does help in that sense. But I think keeping the skin looking youthful, plump, making sure that you're, that is how you get to that glass skin looking appearance without doing the things over and over and over and actually causing harm.
Yeah, I think that as we exfoliate, right, then we disrupt that upper cap or that barrier that holds the moisture in. That's what our skin is literally for, to hold our moisture in.
Yep.
And so the moisturizer acts as a sort of restorative or barrier cap that keeps that moisture after we've exfoliated. And so especially if you are an aggressive exfoliator, then you need to really find a good moisturizer.
You use it often.
Yeah, and use it often. Like, moisturizer is not my favorite thing. I feel like it's like...
It's not mine either.
Yeah, it's like I think it's kind of the least important, which I think is funny because moisturizer used to be all the rage. Like when people did nothing, they used to like moisturize, and that was the one step they did. And in my opinion, most of the time your body's pretty good at keeping moisture in unless you're doing stuff. Let's see, what else is in the glass skin protocol? Because again, these people are like hydration layering, and I'm not sure how that works. Like at some point, there's too many barriers.
Yeah.
SPF.
Yes.
What's the deal with SPF?
So important. If it's the one thing that you put into your routine, use sunscreen.
Yeah.
And I think that we even see it, like the Gen Z generation, I think has actually done super well with sunscreen because of we'll say older generations didn't use sunscreen. Right. And they're like, if you could do one thing, just use sunscreen. Because right now they're in the stages of cleaning all that sun damage up.
Yeah, I think if you're under 25 and you want to invest long-term in your face, sunscreen is like a way better investment than like removing your buccal fat.
Correct.
Yeah.
Yeah.
Like and again, to get into the technicality of it for those who want to know, right? The reason why the sunscreen is the most important component is almost every other part of what you're doing is acting again on those upper layers, and those upper layers are temporary. So they're creating a temporary effect. UV rays from the sun penetrate through the epidermis, they get down into the dermal layer, and they cause breakages in the DNA strands of the cells themselves that make those new layers. And so once it happens, that those basal layers, those dermal layer cells, they don't get remade.
Yes.
So once they've been damaged, they're damaged for the rest of your life. Or you have to start doing other procedures, like more advanced laser procedures, things that pierce through the dermis to get the surrounding cells to like do a better job. But the cell itself that's damaged never really goes away. Yeah. And so once the damage is done, it's done forever, and you will not notice it until those workhorses start to slow down in your 40s and 50s and then don't work. So it is the number one most important thing if you're in a environment that really has a lot of sun exposure. And I think that one culture that has been doing this very well, again, is the Koreans, right? They find beauty in lighter skin pigment. And so they protect their skin from the sun for forever, and that's why you see people of Korean and other Asian descents, like they're like 90, they're like 90 and they look like they're 40, it's no sun damage. And so that is the number one like investment.
For sure.
Okay. And then how about backwards? What's left? We got our serums and we got our cleansers. Anything on the serum? What do you use? Like, what do you think about like serum in general? Like your vitamin C's, why is that important?
Yeah, I mean, your vitamin C, like an antioxidant to help with like overall skin protection throughout the day.
Okay.
I think it's a super important one to incorporate if you're trying. I mean, it is more on like the advanced, probably like skincare regimens. And then I use serums. P-Tox is what I use, an HA intensifier.
Okay.
Again, because I have started Botox. I am one of the Gen Zers that have started Botox, but I don't do baby Botox.
Okay.
And
What's
so
the difference? I don't actually even know the difference.
Yeah. So, I mean, baby Botox, from my understanding and what I've had some patients come in and ask for, is baby Botox, less units.
Okay.
And they want to be like preventative. They don't want lines to form, so they want baby Botox.
Okay.
But like when I'm thinking about it as an injector, dose equals duration, right? And so if I'm injecting 10 units into your glabella, it's not doing anything.
Or at least long term.
Yes.
Okay.
Long term. Like you may have some like, paralyzation, we'll call it, and your muscles aren't making those lines for a small period of time, but then you're just going to have to do it more often. And that's not good to be doing.
Okay. Why isn't it good? What does it matter?
Yeah. So like if you're constantly injecting Botox or any sort of neuromodulator, whatever, you are using, if you're constantly getting injected, like, say I have to get my baby Botox every 2 months instead of like 3 or 4, your immune system will over time can develop antibodies against it. Yeah. And so then when you're 30 and you actually need it to work, it doesn't work anymore.
Yeah, exactly. And this does become a problem. Like, again, my wife started her tox in her 20s and 30s, late 20s, early 30s, because I was plastic surgery resident, so like she would be my like guinea pig. But you do start to see this, right, over time with constant use and underdosing. It's kind of like developing antibiotic resistance. If you're underdosed, right, and the body starts to take a hold of those antibodies, then it becomes less effective over time, and then you're not getting a good result later.
Yep.
And you're right, it's dose equals duration, and so at some point there's a specific dose that has to occur. And the question is, what are we treating? What are we going for? And, do we actually think that like the fine line is not going to get created if we don't treat it? Do you think that's true?
Like you're saying, if you just say, I don't want Botox.
Like if you start tox early, let's say we have a patient who's not doing baby, they're doing like regular tox in their 20s. And it's quote unquote preventative. Do you think it actually quote prevents the line from forming?
I do think it helps. I still think you eventually will get, some sort of line. Like, Botox, when I have been doing, and I do like normal dosing. I don't do baby Botox. Okay. I still have like at 2.5, 3 months, like movement come back. And so it's not that you're like forever making that movement go away to create the static line, but I do think you're in a better position to like treat it essentially. Okay.
I mean, like, do you think that when you treat tox, like when you do, I remember Botox or Allergan's line of like the rule of 3, and it's like when you do 3 treatments, do you think that people who have had static lines actually start to have fading of that line?
Improvement, we'll call it. Okay. It definitely depends. I've seen, if say someone is 50 or 60 and they've never done Botox before, and they have a deep static glabella line, 3 treatments is usually not enough to get rid of it. Sure, we may see improvement in the line, but at that point, I think you're looking at other treatments like lasers and things like that to actually have like collagen stimulation and some resurfacing things to actually get the line to, if you want it to go away.
Yeah, I mean, this is a tough one. I mean, I got to admit, like, my wife doesn't have any static lines, and she's in her 40s, and she's had good volume retention, and I'm seeing some other things. So there is something to say that like the Botox can quote unquote be preventative. I see a lot of like commentary on how you can get thinning of your muscle over
like
time.
Atrophy over time.
What do you think about this? Because now brow lifts are coming into play earlier and earlier, and people are saying, oh, it's because they got so much Botox that their brows descended over time and the muscle is like paralyzed. What do you say to those people?
I think that if you if you're constantly treating like those people that are like, I only want 5 units in my frontalis, and you're like constantly treating and treating and treating, you can, I have seen hypertrophy on people, actually, on areas that they don't want to treat. But I have not a lot of patients that I've seen true atrophy in their muscles, but I've seen hypertrophy specifically in the glabellar region.
In the glabellar region? I mean, it's that did bring me some pause of the idea of do we have ligamentous descent? I was just at a meeting this weekend, and we were talking about the major and minor ligaments of the face, and this gets a little bit technical, but there's a debate even amongst board certified plastic surgeons of does the body's ligaments actually stretch with age, or is it the tissue around it that stretches and or kind of falls into those ligaments? And so, like in the brow region, we often see this descent of the lateral brow, but there's these ligaments here that actually don't let the brow move. And so the question is, are those ligaments moving, or is it really that the forehead is becoming heavy, the temple is becoming hollow, and the eyelid no longer supports, like there's hollowing of the eyelid? Most arguments would say that it's the latter, that you're having volume loss, orbital expansion, and that's what's causing the brow descent, which means that if that's true, then Botox would not worsen the problem. But we don't actually know. So, I think there is something to be said. If you're too preventative, could it cause you to need a brow lift early? Maybe. Verdict's still out.
Yeah.
And so, I'm not sure if I can always recommend everyone starting Botox as a preventative measure early on. Again, I think that we talked about the skincare, and I think that's the number one thing.
I think so too. I think doing things, again, like these microneedling treatments and things like that is one of like my own favorite treatments is microneedling. But again, this like DIY on, like TikTok, where people are doing it like every 2 weeks, it probably isn't great.
That's gonna definitely create a lot of
exactly. And so I think that there's other ways that you can go about like preventative things for your skin for sure.
Yeah, I mean, like again, I think this always has to be in custom consultation, right? You could have someone that has early glabellar, like very strong glabella, early lines, early etching in their 20s, and like treat them. But that's a difficult one. Let's move, as we're going to run out of time. I want to move on to two things. Like most of the filler I see in the face in people in their 20s has mostly been lip oriented.
Yes.
Have you seen a big trend towards filler in other places?
Yes.
Okay.
In the cheeks.
In the cheeks?
Sure.
Okay.
Yeah. And again, I think that this may have to do a little bit with the like selfie thing and like filter-ish thing. Everyone wants these like high cheekbones. Okay. And I've definitely seen that trend more often today. Okay. So it's interesting. Again, like I don't know if it's that they're seeing their influencer friends get cheek filler and then they want it, or just they want high cheekbones. And so the first thing they go to is filler. Yeah.
I mean, there's not a lot of good options if you do want high cheekbones in that age group. Again, we know as we get older, we're losing fat volume and fat descent. That's what is treated through fat grafting and facelifting techniques. But obviously someone in their 20s hasn't had that happen, right? So one of the things that I think is challenging is that filler and the way it's made, I want to do a whole separate like Instagram or podcast on this, but filler, they've modified the molecule so it becomes structural, right? And the thing that we've learned over time is that the filler doesn't dissolve.
No.
It's the structure that falls apart.
The bonding of
the bonding, right?
Yeah.
And so the reason that you get these high cheekbones, this strong jawline definition, is because the bonds hold, like we call it the tent pole effect. It creates that filler that you inject forms like a little pillar, and that's why you can take very small volumes and create these effects. What happens is that the filler doesn't go away, it just collapses. And so you lose the visual effect, right? But the filler's still there. And so then you keep injecting and injecting and injecting, and especially if you start in your 20s, by the time you're in your 30s, then you're pillow-faced, right?
Yep.
And you're just like full of filler. And then you go and you're like, I'm going to dissolve all the filler. But the dissolver damages your hyaluronic acid, which is like the main moisture molecule you have, and it damages your collagen. So even the act of dissolving the filler creates like downstream effects. So I do think that like filler is probably that's a challenging one, because they could come with that concern and it makes sense to do it.
Yeah, I think it's super important to, like, when you're starting filler, to have sort of like a long-term plan, if that makes sense.
Yeah, I think so too.
You know, like, I struggle with these like filler specials where it's like, oh, buy 3 and get 1 free, because patients are gonna want to do that and buy that special, but do they really need 4 syringes of filler? Maybe they do, maybe they don't. But again, this, like, it encourages them to buy all of that filler, and if they're in their 20s, like, that can lead to problems down the road, like long term. Yeah.
You know, I think that one of the things that I do think is a nice target for patients is liquid rhinoplasty. You know, like, you're looking, like, you want to talk about rhinoplasty, you see a problem in your nose. You know, again, liquid rhinoplasty happens with very small volumes of filler. Again, it's a structural tent poling effect of the filler. Even if you have to dissolve it, it's not like a huge deal if you don't like it on a one treatment. But I do think that one of the things that's become big and we're excited about, like, in plastic surgery and in our office, is the idea of preservation, dorsal preservation, you know? For sure. And this idea that if you wanted to have a rhinoplasty like 10, 20 years ago, you had to take it apart completely and then kind of put it back together. And a lot of young people just have small problems, right? And so, again, liquid rhinoplasty or even preservation, dorsal preservation, lets you make small adjustments to the nose without, like, basically tearing everything apart and starting over. So there has been some positive movements, but I do think anything that's reductive, like reductive surgery, buccal fat is one of the biggest examples of this, where once it's gone, it's gone. It's gone. Yeah. I mean, is that still, have people, like, realized that's a problem on TikTok yet, or are we, like, still on it?
I feel like maybe we've gotten through. Okay. I don't know. But anyone that asks me about it, I'm like, in a few years, you're going to wish you had that
your
back, you know? Yeah. And so hopefully we can get through to them.
Through that phase. Yeah. I mean, the buccal fat in particular is very challenging because it's not like all the other fat in your face. Your buccal fat is in a completely different location. It's in a different region of your face. You can't refill it once it's gone. Yeah. You know, if you lose fat in your cheeks, you can kind of, again, augment it with fat grafting and stuff like that. But there is no successful technique for restoring buccal fat. No. So yeah, it's there's some good candidates for it, but that was a weird kind of trend.
I know it was kind of weird. I feel like I've seen less of it, but definitely, I feel like maybe a year ago I was seeing it, like, constantly, and it has kind of declined since then. So.
Yeah, I mean, I guess it always comes down to, there's things that are like the line I kind of draw are you treating or are you prejuvenating, right? And that's how we talk about things in this office. So if you have a consultation in our office, we try to say, okay, we have our treatment line, like you have a specific problem, we're going to treat it. And then we have our prejuvenation services, which are very thoughtfully oriented to kind of help keep things maintained without hurting things. And some of these treatments can be pretty intense, you know, like, for example, like Moxie from Sciton, like, again, it's a no joke treatment, but, like, it is very preventative, and it is able to kind of keep the skin doing well over time without getting too invasive. And so, yeah, I don't have a super strong takeaway, other than what I always say, which is talk to someone who is an expert, you know?
Yeah. Create a long-term plan.
Create a long-term plan. That's the takeaway. Okay. Don't just one-off things. So, well, thank you everyone for joining us for another episode. Thank you, Katie, for joining us today.
Thanks for having me.
And as always, if you guys have any questions of anything we talked about, leave it in the messages or comments, or send us a message. Thanks, everyone.